share the screen?
You're free to share your
Oh, I'm
PowerPoint.
free to share. Okay. 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 Well, thanks for inviting me to be here today to share information about our agency, Care Connection for Aging Services. We have 3 operations here in Johnson County. Our central office is here in Warrensburg on the lower level of the West Side Depot, where the family pawn shop is probably the thing that people notice the most. They're on Business 50. And then we have our Warrensburg Senior Center in the community center, and we have a senior center over in Holden. So it's not moving for me. Ah, there we go. Okay. Our vision is to serve the people that we serve will live with maximum independence, respect, and dignity. And we strive to provide opportunities to create positive aging experiences. So our target audience are those folks that are 60 and over in our service area. We are part of a national aging network, starting at the national level with Congress enacting funding for our program, which is a good 50% of the dollars that we utilize to provide services in our area. Those dollars flow down to the state along with requirements, federal requirements, state requirements, to what are called area agencies on aging, which we are one of 10 in the state of Missouri. Then we take those dollars and use those in the communities through our senior centers and through other services that I'll talk about here briefly. We also do have a whole community matching program, whether that's the fundraising we do or in-kind that people support us with by volunteering or giving us goods and services and those kind of things. So this just shows the state of Missouri. We are here, number 3. There are 10 of us in the state of Missouri that are designated as area agencies on aging. Our charter is to plan, develop, and coordinate a comprehensive network of home and community-based services for older adults. We provide information and services. We promote health and independence. We certainly advocate for older adults, and we are a nonprofit here in the state of Missouri. This is our 13 county serving area that we serve. It was initially back in 1973, developed with around 3 regional planning commissions. There was the Missouri Valley up in these 3 areas, then the Show Me were for these 3 counties, and the rest is the Casing-Urbation area, and that became our service area. We currently have 22 locations, 21 senior centers. Everywhere where you see a dot, we have a senior center location. And then again, in Warrensburg, we have our central office where we have about, when we're in-house, which currently we're not in-house, most of us, but we have 22 employees here. Overall, we have around 120 employees throughout those 13 counties. So our community focus is to do community development, needs assessment for the services that older adults need, do planning to provide those services, do public outreach and education, and then of course, provide the services themselves, the service delivery. We focus on independence versus dependence. So we have one program we do in the nursing home setting, but basically we focus on the senior that is in the community and how to keep them in the community. So we're home and community based. We try to be seamless, be a one-stop that people can call us and get the answer they need, or get maybe their next call will hopefully be the right agency that they need to talk to and not have to make 5 or 6 calls to find that information out. We integrate health and social services, and then we also work to develop healthcare partnerships. So we have a rapidly growing older population. They're living longer, which is awesome. We have 5 of our counties are in the top 10 with the percentage of people 16 over are the largest amount. We have one county that 40% of their population is 60 and over. We have more people that are becoming caregivers, and certainly an increased need for things like adult daycare services, which is very hard to find out there still in our service area. This just shows 3 of our counties, not Johnson being one, and the percentage of seniors in those counties. We also have a large percentage of people 75 and older, 34% of our population, and then 10% or 85%. And of course, that was based on the last census. So we're interested to see what happens with the new census when those figures come out. The other thing we deal with besides aging is that people have a lot of chronic conditions. And so that's why we focus a lot on health and wellness programs. 80% of the seniors in the state of Missouri have one chronic condition, and at least 50% have 2. So it's something that we're also working with to help those stay independent and in their homes as long as we can. So I'm going to run through some of our major program areas real quick. And so one of our base programs is information assistance. So people just calling us, coming into our building. Right now, we're not open to the public, but normally people would walk into our doors. And providing them information about services, resources, agencies, benefits, and assisting them right now primarily through phone calls to link them up to the services that they might need or help them, assist them to fill out applications or whatever it might be. We then, that program builds into our case management program for folks that need additional help with living at home. So we provide answers to a wide variety of questions. We connect them to services. We link them up with our services and other services and agency. And we do case management services with those clients. We also do have a benefits enrollment center where we work with people to help them apply for several money-saving programs. Whether it's, Medicaid or food stamps or whatever program it might be, we help them link up to those programs, energy assistance, those kind of things. And our senior center is our largest program and where we serve the most people. We normally have meals on site, what we call congregate meals. All of our senior center dining rooms are closed right now, have been since March 16th. And so basically we have had to do our programming differently. So we offer a variety of programming and we have changed that over from in-person to virtual programming. And we have a whole list of programming options that we're doing, from book clubs to Tai Chi to Medicare information, etc. We're calling it the Learning Connection, and that document that has all of our classes is on our website that you can link up to there. It's been really interesting with that program because before we would travel to all our locations, and sometimes you would drive 2 hours to Nevada and 1 or 2 people would show up for a program and then you had to drive 2 hours back. So it was really actually, not good use of our funds. This way we can serve people throughout the whole 13 county area. In fact, the staff was telling me we're starting a new program called for what we're going to run a second class, Walk with Ease. And they have a person that's signed up from Canada. So that's kind of an interesting twist to what we're doing. We're doing Tai Chi. We have a lady in Jeff City that participates. So it's been a real interesting opportunity for us and to change up the programming that we're doing. Our nutrition program is our largest program in our senior centers. We serve normally, as I said, congregate meals in the dining room and then home delivered meals, a lot of home delivered meals. But during the pandemic, we've had to, as I said, close our dining rooms. And we're either delivering more people meals to their homes, or we have offered what we call curbside, where people can drive by and pick up a meal and make a donation and take that meal then home with them. And so we've changed up our delivery processes that we're very contactless in our delivery. We, during this time, well, I think almost the whole state of Missouri is in the red zone for the pandemic. I know all 13 of our counties are. So we have gone back to a lot more frozen meals so we can deliver less. So we're putting our volunteers less at risk, our staff less at risk, and the senior in their home less at risk from contact with each other. So, but our staff has stepped up and made sure that all our seniors, we never skipped a beat. No one did not have a meal when this happened, and we closed our dining rooms, but we certainly had to change up our processes. We have a lot of health and wellness programs, as I kind of mentioned, Tai Chi, chronic disease self-management, diabetes self-management, matter of balance. We're going to be starting a brain health program in January. And so again, a whole wealth of programs that we're providing either online or by phone. And again, that learning connection list is on our website. We provide transportation services primarily through OATS. When you've seen OATS bus running around, it's probably us paying for it to run around. So though we're not doing as much of that anymore either, because they were bringing people into the senior center. So they're doing more medical appointments and essential shopping business kind of activities through the OATS operation. We also have two other programs we do internally. One is called Provide a Ride, where we, again, we're not doing that right now, but that is where we have volunteers that would transport someone from their home to their doctor's appointment, say in Kansas City, and then bring them back. They volunteer their time and we reimburse them their mileage. And then we do what we call consumer directed, where the consumer or the person needing the transportation, we would reimburse them the mileage to get to and from their medical appointment, and then they would find their own driver and pay those dollars onto that driver. So kind of the three types of transportation we're doing. I know OATS is providing transportation, but it's less than before March, that's for sure. We also provide in-home services, which include things like homemaker, personal care, telephone reassurance, friendly visiting, and shopping assistance. Homemaker is things like house cleaning, changing the linen, preparing meals, those kind of things. Personal care would be bathing, dressing, laundry, etc. So we have really vamped up, increased our telephone reassurance program, where we're making friendly calls weekly to seniors through our volunteers that are out there. Social isolation is a big issue and a big concern of ours. And so we are making sure people are at least contacted at least weekly, especially those who are in our home delivered meal program, but others that would have expressed interest in having a call. And so we've, certainly increased those during this pandemic time. But having somebody reach out to you is very important for your mental well-being. So we also provide services for family caregivers. So this is different for us. That before we were talking about services for those that are 16 over. This is for their caregiver. So if I was caring for my mother, then the services are designed for me. What do I need? My mother might need other services that we can provide, but this is to help me stay in my caregiving role as long as I can and support that person. And so we can, again, help that person stay at home as long as possible. So we work with family caregivers to link them up to services that will assist them, or support groups, training, those kind of things that they might need to be in that family caregiver position. We, of course, advocate on behalf of seniors. We do that as an agency, but we also have a program called the Silverhaired Legislature, where we have an elected individual from each of our counties serve as a representative, and then we have 3 senators in our 13 counties. And they also, they do follow the whole legislative process in a period of 2.5 days normally. This year they did it on a afternoon conference Zoom call. but they will select 5 pieces of legislation that they then pursue with the legislature in the coming General Assembly year, and work to try and impact the well-being of older adults in the state of Missouri. So we also have a federal grant that we've had for 20 years where we work with people on Medicare to help educate them about Medicare themselves, but then to also detect and report healthcare fraud and abuse to our programs that we can report on, because Medicare fraud is a big problem. And it's interesting, I think, if people would put those good ideas to other uses than trying to figure out ways to defraud people, that would be really wonderful, probably for the whole world. But this program is, again, we do a lot of education, and then we do a lot of work with individuals who feel that they were inappropriately billed for something, or whatever it might be that their issue is. So another program we work on. We do a lot of outreach through our website, www.goaging.org. We have social media. Right now, you'll see that today we'll have several posts on Giving Tuesday. We're participating in Giving Tuesday this year. So we have a number of stories about folks that receive our services that you may want to check out on our Facebook page. We also do a newsletter, press releases. We email our newsletter. We just any way we can get the word out. A lot of older adults still listen to radio, so we do that methodology. So anything and anything we can think of to get the word out. We have a very small program that we provide legal assistance through the legal aids in our 13 county area. So that's a very small program, but that's for advice and representation for folks in our area. And then our only program that we do in the nursing home setting is the Long-Term Care Ombudsman, where we recruit volunteers who will serve as advocates that will go into the nursing home and do friendly visiting, and then they will help mediate issues if they arise between the residents and the management of those nursing homes. So use a lot of volunteers, well-trained. There's a very extensive training process to be a volunteer in this program. We also have a grant to provide the retired and senior volunteer program in Johnson County, as well as 5 other counties. So we're recruiting volunteers not only for programs that we provide, but for other agencies in our communities, sometimes food banks and adult literacy, things like that. We have one for-profit venture. It's called CareNect. It's a personal emergency response system. My kids call it the button you push when, I fall and I can't get up. I think that's somebody else's slogan than our company that we use, but it's called CareNect. And so we provide that option for people to purchase, and as well as we give them information on the other options out there. We also work with veterans. We have a program where we're working with the VA medical centers to provide home and community-based services to do the case management for that program in our area. One of the things that we do might sound kind of strange, but we are the navigators for the Affordable Care Act. And we do that every year. Our state association applied for that grant when it first came out, when the ACA first came out, and we have been providing that service in our 13 county area ever since. So right now, they're in the process of helping people now. The Affordable Care Act, or Obamacare, or whatever you want it to call it, we're in that open enrollment period. So, and then we also do Medicaid work. We do reassessments for those people getting home and community-based services, as well as we provide Medicaid home delivered meals. So how can you make a difference? Volunteers are a big part of our program right now. That's limited, but normally we have a lot of volunteers. Right now, pretty much they're either doing telephone reassurance or they're delivering meals, and not some of the other things that would bring them into our centers. but also you can support us financially, encouragement, make referrals, let people know we're there so that we can help them. My goal was always that somebody wouldn't say to me, I wish I knew about you when I was taking care of my mother. You know, that's a little late. So hopefully if you can share with people that we're out there and they can contact us about services that they might be available for, and then also contributions. Our program is pretty much based on a contributions for our programs because of our federal funding. So we don't charge for most of our services, though with our health and wellness services, sometimes, or if we do a craft or a different thing, there might be a cost for supplies and things, but normally our services are at a contribution basis. So that's pretty much what I have at this point. I do want to mention, again, it is Giving Tuesday, so if you feel so inclined, our admin, I think, rate is like, I want to say less than 9%. So I think it's more like 6. So, so we're a good bang for your buck. And I wanted to mention that our Warrensburg Senior Center is working with Big Brothers and Big Sisters. Look for more information to come out about the holidays for Homeshore, which they're doing virtually this year. So it's December 2nd through December 31st. And I know there'll be more information will be coming out about that in the chamber newsletter that you can participate if you would like to. So I'll turn it back to you, Amanda.
Thank you very much, Diana. So next up, we're going to have Mia Gonzalez with KC Behavioral Health. And Mia, I'll let you introduce your other presenters as well.
Helps when you unmute. Amateur move there. Thank you so much. It was really nice to learn more about you, Diana, and your services. As Amanda said, I'm Mia Gonzalez, and we're with Behavioral Health Holdings. We are new to the Warrensburg area. So what I'm going to do is, because some of you have heard from me a few times, I'm going to introduce our CEO, Mark Goff, and then I and Aaron Rosensky, the president of BHHKC, will go over the services we're going to be offering. So as I mentioned, we are new to the area, and it has been about a year in the making, working with local community organizations to really understand how we could be best of service in the, not just Warrensburg, but Holden and Sedalia and things like that. So without further ado, this is our CEO, Mark Goff, and I'll let her tell you a little bit about herself and why we're here.
Good morning, everyone. First, let me thank you for the pleasure of participating today and getting to know you and hear more about our Warrensburg market and the things that are going on to support all individuals and peoples in that community. So we're very excited about the opening of our programs in Warrensburg area. So I just want to take you through a little bit how we came to be. We made a decision where we're very blessed to be part of the DeBruce companies. Everything we do supports the DeBruce Foundation, which supports, and it has been formed to really deliver care and support to individuals through education and training. So very happy to be a part of that. We actually acquired an organization in October of 2016 called PBM, Partners in Behavior Health. We rebranded and became Behavioral Health Holdings. Our goal and intention and our mission, of course, is to create meaningful changes in the lives of individuals with disabilities. and their families, and through the use of evidence-based practices and dedicated service providers. So I'm thrilled to tell you we're a little bit of a unique organization in the fact that we serve all population on a continuum of care, really, to support those individuals from the early childhood to the residential needs of our clients. So our program, our company, we have a clinic, a nice clinic that cares for our individuals from 3 to about 7. And our goal and objective in that clinic is to prepare individuals for kindergarten. We then take it through academy and school, into crisis support, into residential services. And I'll let Mia and Aaron talk more in detail on all of those. Our goal, of course, is to provide these services in communities, other communities in need. You all are probably very aware of the need to provide those services, not just as Diana talked about in our senior communities, but also in the developmental disabilities community. So we're thrilled to be a part. I'm excited to say we have affiliations with Kansas University, where we provide practicum sites for their clinicians and their professionals. We just signed an affiliations with UCM, which you all are very familiar with, hoping to work closely with them to provide also practicum sites for a number of their programs. We have the opportunity to employ over 250 employees. We spend about 3 to 4 weeks training and educating those employees. So we're really blessed to have the number of individuals that we have working for us who truly have a head and a heart for what we do. So with that, I'm so happy again to be here. Our goal, of course, is to provide additional services in the markets outside of Kansas City, such as Warrensburg. So I'll turn it back to you, Mia.
Thank you, Mark. Yes, as you can tell, we're super excited. So our specialty is working with individuals that have developmental disabilities through the spectrum of ages and challenging behaviors. So our mission is to create meaningful change. And through that, we provide evidence-based practices through dedicated service providers. You know, BCBAs is our big thing that I've learned so much about over the last year that I've been working with BHH. So some new services we hope to start in January is our early intervention clinic, which I will let Erin go ahead and jump into, and she'll also talk about some things that we already have going on in the community. So Erin Wazinski is the president of BHH KC.
Thanks, Mia. Again, thank you guys for your time today and allowing us to come and speak to you about the services we provide. Just to kind of backtrack a second, I know a lot of times we use acronyms because it's the lifestyle that we live, but so we utilize board certified behavior analysts, which are certified clinicians who provide behavior analytic services utilizing the science of applied behavior analysis. So in all of our divisions, from early childhood through adulthood, we know that there is research-based practices out there that we can modify and change behavior and teach individuals how to be successful members of the community from an early age with utilizing that science. So we're very fortunate to have a great team of clinicians who oversee all of the clients that we support in all of our divisions to provide those services. So as Mia said, we are excited to be adding an early intervention clinic in the Warrensburg area. We do have a clinic here in Kansas City. We service those kiddos that are just recently diagnosed with an autism diagnosis. So we work with individuals with a variety of disabilities, whether that be autism or Down syndrome or mental health diagnoses such as bipolar disorder, but they all have an underlying diagnosis of a developmental disability. in our early intervention clinic, they all have that autism diagnosis because we work directly with insurance providers who fund that service. So as of right now, insurances only cover those services for individuals with autism. So in our clinic, our itty bitties, it's all individuals about 18 months to 7 years old who have that autism diagnosis. They come to our clinic and receive clinic-based services, which are one-on-one, where a registered behavior technician implements the plan that the board certified behavior analyst writes. So they can come to us typically anywhere from 20 to 40 hours a week where they're receiving intensive therapy, working a lot on language development, communication, social skills, play skills, really preparing them to be ready for kindergarten. I know one of my favorite success stories out of our early intervention clinic is a young man who came to us when he had just gotten a diagnosis of autism. He, wasn't really communicating effectively, engaging in a lot of tantrum behaviors, and he then was able to transition to kindergarten and receive services in his regular kindergarten setting. Didn't even qualify for an educational diagnosis of autism. So really incredible and really life-changing for these individuals and families, as well as for us as taxpayers we know if we invest in these individuals early on and teach them the skills, then it's going to decrease the amount of funds that are required for them throughout their lifespan. So that's our early intervention clinic. It's a fun, happy place to be. You can always walk through, and if you ever need a smile, it's a great place to be. So our other division and service that we have is Milestone Academy, or our educational services. So we have a school here in the Kansas City area, and we also plan on expanding that within the Warrensburg area because we currently have about 7 individuals who get transported every day from the Warrensburg location to Kansas City to receive educational services. These individuals are individuals, again, who have developmental disabilities, ages 5 to 21. One of the big things that is unique about our organization is we truly specialize in providing services to individuals with developmental disabilities that have not been successful anywhere else, typically due to their maladaptive or challenging behaviors. So many of the students that we support at Milestones have not been successful in their school setting because of their significant challenging behaviors. But due to the resources that we have with our clinicians and special education teachers and paraprofessionals and crisis teams, they're able to be successful in school. So our goal is to always transition them back to their homeschool setting. We always want them to be going to school, with brother and sister or their neighborhood friends. So we work really hard from the moment they walk in the door to identify what do we need to put in place so they can go back to school with brother and sister, and really be most successful in the school environment. So then we also have our residential and crisis services. So our acute crisis services is a short-term service that's provided to individuals who are in acute crisis. Many a times these individuals all have that developmental disability diagnosis. So we do not provide services to individuals with substance abuse issues or other kind of behavioral health disorders, but all of the individuals that we support have that developmental disability. But these individuals typically transition to us. They are typically in a hospital, they are in jail, or mom and dad or provider are just hands up, we can no longer do this. We can't keep them safe. We can't keep the people around them safe. So they come to us typically for about 60 days, very short term, but very intense setting that they're receiving intensive services. So they come to us and they're receiving 2-to-1 staffing 24/7. Those staff are implementing the plan that's put in place, working on behavior reduction, as well as working on skill acquisition. So we are teaching skills so they, instead of when I don't get my way and I wanted to play the iPad, but it wasn't available, instead of destroying the room, I learn how to effectively utilize other skills. We work very closely with the guardians or family and providers during this time. We have weekly calls because we want to, again, transition those individuals back to a less restrictive environment where they can be supported. So we know a huge part of that is the training and education of the receiving team to be able to implement the resources and plans that we have put in place. Kind of a success story there. I always like to share those. We had a young lady who came to us who had been in a St. Louis hospital for about a year. She then moved from a St. Louis hospital to a Kansas City hospital. She was there for over a year, and she came into our crisis services. She was with us a little bit longer than typical, about 90 to 120 days she was with us, and she had to really relearn everything. She had been in a hospital setting for almost 2 years. She had been heavily medicated, and her behavior was managed by medications and restraints, mechanical restraints. So she came to us, and I am so happy to report I'm still in very close contact with her mom. She actually just sent me an update for Thanksgiving. She's living in an independent supported living home. She has friends. She has a trainer. She's going to the gym 3 times a week. She's preparing her own meals and just truly excelling. So really, really incredible to see, this young lady who had built this history of behaviors that was requiring to be medically and mechanically restrained on a daily basis, costing thousands of dollars a day to be in a hospital, be able to be living independently in an ISL, independent supported living home. So really great successes that we can have there. We also have our residential services. So this is more of a long-term care. So these are individuals, again, with a developmental disability who have not been successful at other locations. So maybe they've been at another group home or another provider, and due to their challenging behaviors, they just have not been able to succeed there. They've either been kicked out because of the property destruction that they cause or the aggression they exhibit. So that's the individuals that we work with, those individuals who've not been successful anywhere else. Because we have this team of clinicians or behavior analysts, we provide something very unique in residential homes that typically is not provided, and that's the oversight and training of from our board certified behavior analysts. So they are, every house that you go in, almost daily, you will see one of our BCBAs in those houses. They're constantly working on plans, modifying plans, training staff to really build the most independent individual that we can. Our goal is, again, to transition them to a less restrictive environment. We want them to be active members of the community and be able to participate in the community. So we have group homes as well as what are called independent supported living homes, which is a little bit less restrictive, that we just provide staffing services to and still provide that oversight from the clinician. So of course, I'm going to tell a little success story there. So we have a young lady who actually just went through our orientation yesterday, our new hire orientation. She's a young lady who came to us in our acute crisis location. Again, was in a hospital setting for an extended period of time. She then moved to one of our group homes and transitioned to a less restrictive group home. And she is now living in one of our independent supported living homes. And she just started a job with us yesterday. She's a paid employee. She, went through orientation with all of our other new hires, and she is beyond thrilled to be able to have a job for the first time in her life where she's making an income. So really great to see her be able to progress through where she started and where she is in just a short period of time of 2 years. So really excited for her. And then lastly, we have our transportation services. So we do transport individuals to and from school. We transport the majority of the individuals who attend our school to our school, but we also transport individuals to other schools throughout the Kansas and Missouri area. So to Lake Mary, Ozanams, Sherwood. We work with a lot of school districts that are unable to successfully, safely transport those students. So our team is a team that's trained in how to handle and manage those challenging behaviors. So if those behaviors occur en route, they can effectively and still safely get to and from where it is that they're going, as well as knowing that things of how to prevent those behaviors, which is the biggest thing that we focus on. So that is us. That's Behavioral Health Holdings. We are here to support the community. We're here to, like Mia and Mark spoke about, our goal is to make that meaningful change, not only on the lives of those individuals that we support, but their family, caregivers in the community. So we can all work together to make that meaningful change together.
Yes, thank you. As Diana had mentioned as well, you know, the groups that are presenting today, please follow us on Facebook and Instagram, and if you ever want to reach out for more information or any referrals, even if it's, I'm not sure if you're the right place, please just reach out to me or Aaron or Mark. I put our emails up, our website, the phone number, and you'll see us around, hopping around, trying to introduce ourselves as much as we can. So thank you again for this opportunity.
All right, thank you guys for presenting today. Now, does anybody have any questions? If you do, just like raise a hand or put it in the chat. I'll wait just a moment. All right.
You did such a good job.
You did. You explained it all. All right. Well, like I said, this will be posted later today. I'd also like to encourage you guys, if you have anything that you want to tell our chamber members, we do have a private chamber members only Facebook group. So kind of like EnGAGE, one of the good things about EnGAGE is that when everybody gets together, they can give a little plug about what their business is, or if they have an event coming up or a volunteer opportunity or something like that. And so just a heads up, you can also do that in our chamber member only Facebook group. And I'll actually, if there's anybody here that's not in that Facebook group, I'll send you the link to it. So yeah, I will hit stop recording.